I'm delighted to welcome Baroness Delyth Morgan here today, who's Chief Executive of Breast Cancer Campaign. And Delyth, Breast Cancer Campaign does a fantastic job in helping to support scientists to find some kind of a breakthrough in the cure of cancer. How much can we do in our everyday lifestyles to help prevent it?
Well, one of the things over the years that scientists have been able to show is that by maintaining a healthy weight, women can reduce their risk of developing breast cancer. And it's particularly important as we get older and we go through the menopause to maintain that healthy weight. And yet we all know how hard it is to do that in these modern times. And of course you and all your franchisees do such an amazing job in helping women to do that. We also know that taking exercise is important in reducing the risk of breast cancer and other cancers. And that's really important because even taking exercise, even if you're not losing weight, it makes a difference. So these are positive things that women can do. And then there's all the evidence around alcohol. I mean, you know, miserable though it might seem sometimes, if you do cut back on alcohol, then that can reduce your risk of breast cancer. So these are all practical things that we can do. And of course, the biggest risk factor for breast cancer is age. So, that's something none of us... Well, genetics, important too. But what I suppose, being breast aware, understanding the risk factors for breast cancer, it's important. But, for many things, heart disease, all types of cancer, the kind of, the advice and support that you're giving women about, adopting a healthy lifestyle is really important.
Yes, well, and all of those things, any or all of them really, are going to help us, aren't they?
Absolutely.
So let's just get the genetics thing out of the way first. If your mother, grandmother or sister had breast cancer, then you are obviously more at risk, aren't you?
Well, what we have to remember about breast cancer, unfortunately, is it's incredibly common. So 48,000 women diagnosed every year of breast cancer. So it is possible to have two close family members having breast cancer and there not be one of the very special breast cancer genes in the family. So it is possible to have a lot of breast cancer and it not to be because of BRCA1 or BRCA2. But if you do have one of those breast cancer genes and that is something that if you're worried about it, you should talk to your GP about, because it needs to be looked at through a family history clinic. If you do have one of the breast cancer genes, then it's associated with breast cancer coming quite young, a number of close relatives, but it's the case where you have an increase of breast cancer risk of about 80%. So it's a very, very significant issue. So if there are lots of breast cancers in your family, you must go and see your GP.
Okay, so we could take that one to one side now, on the basis, obviously that's very important if that's relevant. Take that aside, we're then talking about general lifestyle. You talked about weight loss, losing weight. I mean, this is something that we've said all the way along as one of the added benefits of losing weight is that you will reduce your risk of some cancers.
Yeah.
How much do you think, as far as breast cancer is concerned, if you do lose weight?
Well, the studies there's a particular study looking at a cohort of women in 2010 and the reduction in breast cancer risk, you're looking at more than 4%. Now, what that means is, say if you're 80, then your breast cancer risk is much higher than if you're 30. So the importance there is understanding that losing weight and maintaining a healthy body weight actually gets more important as you get older, and something that's harder to do. So you know all about that.
And it is one of those things, is as we get older, there is almost an acceptance, though it can be, that I'm getting older, I'm going to put weight on, I'm not going to be as fit. But in actual fact, what you're saying is it's even more important to get your weight down than as a help towards...
And I think that one of the sad facts of life is that a lot of breast cancer is promoted by the hormone estrogen, and in body fat, that's where you find a lot of estrogen. So, that's the kind of theory that around that, where, if you are postmenopausal and you've got a lot of body fat, you're hanging on to a lot of estrogen. So that's the kind of theory behind that argument.
And that makes sense, doesn't it? And then the fitness thing, I mean, obviously, and quite a lot of our members would be considered to be menopausal sort of age. And the fact that we do incorporate in our slimming classes exercise as well really does give both benefits, which is perfect for those older women, isn't it?
I think that's right. And there's so many reasons why older women benefit from being active, and exercise gives a risk reduction benefit almost, independent of the weight. So if you're exercising and maybe not getting the weight loss that you were looking for, you're still doing some good. And
there's quite a big benefit from exercise, isn't there? Isn't there? I can't remember is it a third that I heard?
Yes, I mean that is a really significant reduction in risk from exercise. So it's
if
really
you
important.
exercise, you're like to reduce your risk of getting breast cancer by a third.
Yeah.
That's phenomenal, isn't it? And then when you hear that by exercising you reduce your risk of getting Alzheimer's, and there's something like a 35% reduction in that, you think, why isn't everybody exercising? Because it's such a massive thing to help our health.
And I think a lot of it is about people don't know how, or they don't know, it doesn't necessarily seem that it's worthwhile. And the more messages that we can get out about that, the better. And for women who've been diagnosed with breast cancer, it's a really tough time. And they're having to deal with all sorts of issues about invasive treatments, the emotional worries. So sometimes health professionals find it difficult to talk to people about exercise, but actually exercise is really important then. And I know from my own sister's experience when she was diagnosed with breast cancer, no one talked to her about doing exercise, and whereas it would have been a really good thing for her to do.
And quite therapeutically good as well,
Absolutely.
as well as physically good for her to do that.
Yeah.
We do have, on this channel, we do have quite a few workouts that people can do that are post-operative from breast cancer patients, and so people can tune in to get those. But it's a great message. Thank you very much indeed, Delyth. Thank you.
Thank you.